Hello, Matadors. So, Associate Students wants to take an opportunity to acknowledge what's going on in the world. It is an unstable place, and it is a tough time in the world right now. With COVID-19 and trying to come up with terms of a possible virtual fall semester, acknowledging the lives lost to this infectious disease, and overall living in times of uncertainty. As someone who studied within the health sciences, I am very well aware and very realistic of the potential drawbacks and changes that can come from a virus. This is a time where we need to take preventive measures to ensure our health and our safety. There's so many rumors and so many misconceptions when it comes to COVID 19, and it is our hope to settle any concerns that the student body may have. We also want to take a moment to acknowledge the essential workers for putting their lives at risk every day to heal those who are in need or need assistance. Thank you. I know that I've been personally affected by this with my mom and my older brother, both being nurses, and just seeing them having to wear a mask for over 8 hours and then coming home feeling very scared, feeling very frustrated with this pandemic. It's frustrating for everyone. And this is why it's really important to have communication and to have a space to discuss these kinds of thoughts and these kinds of concerns. In the light of the safer at home measures and communication with the health department, it is very important to AS Vice President Dion Turner and I to bring some key figures to CSUN and to discuss these issues, to answer these questions, and to express the student concern. Today is my honor to welcome our very own Director of the Class Student Health Center, Dr. Linda Reed. And how do you pronounce your last name? I don't want to butcher. Kiziako?
Chassiakos. Dr. C.
Or Dr. C. Perfect. I heard that you go by Dr. C. So, yes, here you go. Here's Dr. C.
Hi, everyone. Rose, thank you very much for this opportunity. First, I want to welcome everyone. And this has been one of the most challenging periods in people's lives, weeks upon weeks. And then this past week, we've had the tragedy that happened with George Floyd, and the advocacy and the turmoil that has been a part and a result of that horrible tragedy as well. It seems as if it's one thing after another. And I want everyone to know as we start, and I will try to answer the questions that you have, but I want everyone to know that we are here for you. The Student Health Center, the CLOT Student Health Center is your student health center. And we have remained open even in the spring and now in the summer to be available for you, either by phone call and telehealth, if that's what you prefer, if you'd like to stay at home, or if you do need an in-house visit or any other services that can't be done by telehealth, we have a doctor, a nurse, laboratory, x-ray, and pharmacy in-house for you, so that we can take care of your needs. And my colleagues on the other side of campus at University Counseling Services are also available because, as Rose has mentioned, COVID is a very worrisome virus, COVID-19. But the worries that we have with it are not only its impact on people's physical health, but on their mental health. So if you're finding either fear, anxiety, isolation, depression, any concerns that you have as a result of either the virus, the lockdowns, the changes in our lives, and the isolation from our families and our friends, and then the tragedies that have occurred in the last week, please reach out to us at the Student Health Center and at University Counseling Center Services, University Counseling Services, so that we can help you. Thank you.
No, thank you so much for starting us off like that. I think it's very important to acknowledge everything that's going on in the world and how much it's affecting our mental health and our physical health. I think that a really good place to start as well is that there's so many questions and concerns when it comes to what is COVID, right? So I was wondering, a lot of the feedback that I got from students was, what should people look for when it comes to symptoms? Because there's a lot of articles, there's a lot of things that the media is saying, but students really want to know, when should I start being concerned?
Well, as most folks know by now, COVID is a new coronavirus, which can cause some serious side effects, especially in people who are vulnerable. It is more easily transmitted than other viruses, including the flu. And that's one of the reasons that we've been so worried about it. And it can be transmitted when people don't have symptoms. And that's another worrisome thing. Because if people do have symptoms, you're more likely going to stay home and go to bed and feel, stay and recover until you feel better. But if you're feeling well, you're going to be out and about, and you may be shedding virus, and the virus may then possibly infect others. So that's one of the challenges and one of the reasons behind some of the lockdowns, to try to keep people physically distant 6 feet or more and prevent secretions, aerosols, and droplets from folks who are infected and don't know it from spreading to others. The face coverings, that's the reason we have the face coverings. It's not so much to protect you from aerosols and viruses coming in, but to keep one's own aerosols, droplets, coughs, sneezes, etc., from going out and infecting others around you. Now, the symptoms can be very variable. When we first started learning about this virus just a few months ago, they were talking about 3 major symptoms: fever of 100.4 or above, cough, especially a dry cough, and respiratory distress. That means shortness of breath, having difficulty breathing, panting, not being able to get a good breath, maybe some chest pain. Now we found that the symptoms can be actually a lot broader. Things like sore throat, things like nausea or diarrhea. Some folks get rashes or swelling of, for example, the toes with some redness. So there are different symptoms that can happen with COVID. If you have a fever or if you have a cough or respiratory distress, you should stay home and call your doctor. That's how I would start. And of course, as a student, the Clot Student Health Center is here for you. You can call us at 818-677-3666 and click on option 1, and we'll be able to arrange for you to either see or talk to a doctor so you can find out if this might be COVID and what you can do. If you do have some of the other symptoms, we usually ask people to think about whether they might be chronic or new. If you've always had runny noses and sore throats whenever the flowers and grasses and trees pollinate in the spring, and this is very typical of your previous symptoms, and you don't have a fever, well, it's probably likely to be allergies. But you can go ahead and call the Clot Center and just get some advice and find out for sure what's going on. Some people, for example, have chronic problems with their gastrointestinal tract, upset stomachs, diarrhea, constipation, things like that. Again, if this is a problem that you've had long term, then it's probably not COVID. You can always call the health center for advice and to find out. But if all of a sudden you've been fine and then these symptoms develop, then I would stay home and then call the Student Health Center, run your symptoms by the nurses and doctors there, and then they can help you address, is this COVID or not? If it is, if they think that it might be, they might just have you stay home and remain isolated for anywhere from 10 to 14 days. Now, the reason for doing that is we don't want folks who are shedding virus to spread it to others. They can give you instructions for home isolation. We prefer if folks have their own bedroom and bathroom and don't share kitchen utensils, cups or glasses, or bathrooms with others. If a bathroom needs to be shared, it can be disinfected after each use with wipes, disinfectant wipes. We have lots of instructions we can go over if we have time. Sometimes they might ask you to come in, and when you come into the Clot Center, to keep everyone safe, including all of our patients, we have screening at the door. And what we do is we have a non-contact infrared thermometer, which goes ahead and measures your temperature. If you have a fever, we will escort you with a mask to a room where you can be seen privately and confidentially by a doctor who's wearing protective equipment as well, so you don't have to worry about your safety. Now, if you don't have a fever and you don't have other screening symptoms, then you'll be receiving more routine care at the health center or addressing whatever problem you're coming for us to help you with. We also offer services such as immunization, smoking cessation counseling, wellness coaching, health education. Some of these are done in person and some of these are done through telehealth during this period, but we're there to help you even if everything's going well, if you just want someone to talk to.
Oh, yeah. Thank you so much for starting us off with a foundation of what are COVID-19 symptoms. I personally didn't even know about the rash. That's something that I just learned right now. So thank you so much for sharing that. Now I know that a lot of fellow CSUN students were wondering, well, how's CSUN gonna look like once we decide to repopulate the campus? Do you have any insight on this, on the repopulation from a healthcare perspective? Or do you have any recommendations to students in regards to keeping ourselves safe and healthy?
Well, we're learning more and more about this virus every day, but it's a new virus, and so it's a learning curve. I like our president had a statement which kind of describes how we in the medical and scientific fields are feeling about this virus right now. It's we're flying the plane as we're building it. And so we're learning a little bit more about it every day. To the original approach that scientists such as folks at NIH, like Dr. Fauci and the CDC, was to try to do a couple of things. Obviously, we want to prevent folks from getting infected. And we have found that there are some people that are much more vulnerable to this virus than others. And folks who are very vulnerable to this virus are generally folks who are over 60 or 65. And then there's a sharp increase in vulnerability and complications for folks in their late 70s and beyond. But that doesn't mean that younger people can't get sick or occasionally have complications. There are medical conditions that seem to be causing complications, and these are things like high blood pressure, heart disease, diabetes, kidney or liver disease, and obesity has been a factor that's been identified. Additionally, and this is something that we might touch on later in the interview, there are folks who are more vulnerable because they're in social conditions and environments that they may not have access to as many health resources or as healthy a lifestyle as others, and we can talk about that a little bit. One of the issues that then comes up is that the doctors and the scientists wanted to minimize the number of people, A, who got infected, and B, who would have serious illness and complications and need to go into the hospital and maybe need to be put on a ventilator and maybe, unfortunately, might pass away. And we have seen that the folks who are at highest risk and the most seriously ill are often folks who are in long-term care homes, nursing homes, facilities that are very dense and that may not have medical care. So the approach was to try to what they call flatten the curve. And what that meant was, we know since we don't have a vaccine, we can't or we couldn't prevent infection early on. So what can we do? We can try to keep people apart from each other so the virus doesn't spread from one person to another. And that's the motivation behind the lockdowns. And then that gives folks time and the hospitals time to get enough ventilators, personal protective equipment, staff appropriately, so that those people who do get very seriously ill have the health resources to be able to be treated appropriately and recover. It also gave time for people to test various types of medical therapies that are being considered. There are some you've probably heard of remdesivir, and there are other ones that clinical trials are going on with, in which they're going ahead and testing them on some groups of very sick people and then not on others to see who does better and who has a shorter course and who has fewer complications. So over time, we're beginning to be able to identify things that are working and things that aren't. And in Los Angeles County, I'm happy to say that we have seen two things. We've seen the flattening of the curve. In other words, we don't see a big peak going up and down. We've seen that the numbers of cases had a small peak, and now they're dropping in proportion to the numbers of exposures. And we are testing more. We have more capability for testing. And we are seeing that the numbers of serious cases are much less than we had originally thought. If we had originally thought that maybe 20% of people would have serious complications, we're seeing many fewer complications than that. So the lockdowns was the first phase, and we have successfully achieved that. So now the state and states all across the US, but California is slowly reopening. The reopening is guided by Governor Newsom and by the California Department of Public Health. And they follow both political and scientific issues in making decisions. There are places in California where there have been very few cases, especially in more rural areas in Northern California. So there is a lot of pressure in those areas to open more quickly and return to a business function more quickly than in an area that has had a lot of infections like Los Angeles. But even here in Los Angeles, the Los Angeles County Department of Public Health, with whom we're working, is opening up slowly
Yes.
and taking steps to safeguard everyone in our community who goes outside of their home, who interfaces with others, who goes to a restaurant, who goes to a service area, a grocery store, a bank, a gas station, etc. So these guidelines are things like wearing the face covering to prevent people from sharing aerosols and droplets, staying 6 feet apart, which is one of the most helpful things we've found, and then arrangements that businesses are making to screen out folks who might be sick and telling them to go home and recover and then come back to work. And then doing things curbside or telehealth or teleservices wise. We're trying to find new creative ways until we can come up, either the virus basically fizzles out or we have a vaccine or a known cure.
Sorry. So you would say, as when we are repopulating the campus, most likely you'll see classrooms go to a smaller number of students, I'm assuming, so we can separate the chairs 6 feet apart. What would you, if
Well,
you have
what
to?
we're looking at for the summer, we're remaining virtual learning.
Of
Now,
course.
we're guided. We have 23 CSU campuses, and our guidance is coming from a number of places: our governor, our mayor, the California Department of Public Health, Los Angeles County Department of Public Health, with whom we work very closely. I'm on a working group with them exactly about returning to class, repopulating campuses. So we're working closely there. But our guidance also comes from the Chancellor's office. And as you know from Chancellor White's communications, what they're planning at this point, and they're working with each campus to develop plans for the fall, is to be open, fully open, but mostly virtual learning. And then to look at some hybrid options, exactly what you're talking about, Rose. The idea that you're going to be able, in certain circumstances, to come in for a laboratory or a class program or project. And what we're working with diligently right now is how are we going to keep you safe when that happens? We have protocols that we're developing through our Emergency Operations Center, along with Chief Murphy, and many other folks in facilities, in physical plant management, air and HVAC systems, custodial cleaning and disinfection, our environmental health and safety department, student health center. How can we keep folks who come back on campus safe? And I wish I had some magic answers, but what I can say is that the best things we can do right now, based on all of the science that we know and understand, is to arrange for folks to remain physically distanced, which means if you were in a small classroom in the past to do whatever your project was or lab was, then we'll put you in a big auditorium and have folks sit 6 feet apart. If you're going to be doing something that requires being closer than 6 feet, we will arrange with your professors to have the appropriate personal protective equipment, PPE, which is a little bit more than a face covering. It's actually either a surgical mask or what's called an N95 mask, and maybe goggles or a face shield, gloves, and other things. So each department that is going to want to bring students back for a project, for anything, has to submit a request to our Emergency Operations Center for review by our risk manager, environmental health and safety, facilities, and the EOC in general. And then we guide them. Here are the things we need to do so that our students and our faculty are safe if they come back on campus.
Wow. Thank you so much for sharing that, because I think that's really important in this conversation, because I think a lot of students are not aware of this committee, and and I think a lot of students are not aware of who are the individuals making these decisions, because I think a lot of times, like before getting myself in this space of student affairs, I had assumed, oh, Chancellor White says everything, and it's not quite like that. Although obviously Chancellor White does have a strong decision making, I now understand that the committee is filled with so many individuals, so many administrators who at the end of the day want to keep us safe.
Yeah. And we do, and actually after we've come up with our plans and protocols, we take them to the president's cabinet, and then they approve them as well. So we've got lots of folks who care very deeply about the safety of our students, faculty, and staff, making sure that we can do the best we can. Now, I wish I could say that coming to campus in the fall and beyond would be zero risk. Unfortunately, we don't have a way to guarantee that yet. So I think I want to kind of bring up the concept that all of us have a shared commitment and a shared responsibility to do what we can to help not only keep ourselves healthy and safe, but protect our classmates, our faculty, all the people that we're around. All of these things that I've mentioned, the face covering, the PPE, the separation, physical distancing, hand washing, frequent hand washing, covering one's cough, for example. If you cough, one should cough into the sleeve, exactly. So all of these things will help reduce risk for everyone and keep us protected. But the risk isn't zero. So there may be people who either are in an older age group or who have medical vulnerabilities, for whom it may be wise to stay at home a little longer and work with virtual learning, or to check with their doctors, either at the student health center if they're students, or if they're faculty or staff, their private doctors, to be able to see just what the risks are for them and whether it would be safe for them to return to campus in the fall. Our goal, obviously, is to get things back to routine function as soon as possible. But we want to be sure that we do it with the lowest possible risk. And unfortunately, even though there have been some promising studies on vaccine trials right now, folks in the know, I've heard estimates about 12 months, but realistically, it could be a year and a half to 2 years if we get a vaccine. So we might have to do other measures.
Of course. Actually, bringing that a little bit into the conversation, I know that A has received a lot of feedback on how to find credible sources. So I was wondering if you can shed some light on how does a student find a credible source when it comes to COVID-19, and what's the best way to stay updated without feeling overwhelmed? Because I know for me personally, if I see too much information and I don't know what is what, I get frustrated and I don't know what to do.
So, a great question. And the first suggestion I would give is both the Student Health Center and CSUN have COVID-19 pages. So you can just Google it, and they update you and they give you updated information, and it's distilled, so you're not getting the hundreds of pages of details that can sometimes be overwhelming or very, very technical if you don't have a medical background. So that is definitely the first place I would encourage folks to go. If you feel like learning more, I know that the Los Angeles County Department of Public Health sites are also excellent. LA City has some good sites, but they're more about policies and how to implement them. But LA County Department of Public Health has a whole section on COVID, and much of the information that they have is written in non-technical terms that will, I think, be easier to understand. And they have frequently asked questions as well, as do we. The California Department of Public Health has some things, and Governor Newsom has some things. And of course, there's always the CDC, which has material both for the general public and for health professionals. I would say one of the things that happens, the internet is a very, very big place. And it's very hard sometimes to find correct or vetted or evidence-based information on the internet, because on internet, a website can actually look very fancy, very professional, and not be a source of good information. Internet can fool you. So my suggestion is to find university-based sites if you want to do further exploration. The CDC is an excellent site, as I've mentioned, and very broad. And then I've been very pleased with the information that Los Angeles County Department of Public Health has been putting out, in addition to ours. And of course, the CSUN sites, both at the SHC and campus-wide, are vetted by me and others who have a medical background to make sure that they're aligned with our state and county, and that we avoid misinformation. So I hope that helps.
No, that helped a lot. And talk about misinformation, I kind of wanted to transition this conversation into a myths versus facts section. Mostly because when I was asking for the student opinions, there was a lot of misconceptions going around. So feel free to interpret these concerns however you'd like. But I think our very first myth versus facts would be, is it safe to ride on a public bus or using public transportation in general?
Well, again, an excellent question. And I think I would approach it this way. There are relative risks with everything. If you stay at home and you don't see or go anybody and go outside, then you're probably looking at an extremely low or zero risk. If you go on a public transportation, the risk is higher, especially if there's no enforcement. And I understand Metro is trying to enforce, because we're supposed to wear face coverings when we go outside of our houses. So I understand that Metro, for example, is enforcing face coverings. But I would wear your face covering, and I would go ahead and take some disinfectant wipes and wipe commonly touched surfaces, and try to stay 6 feet apart from others. And then when you arrive at your destination, make sure that you wash your hands. And when we talk about hand washing, what's important is not to go in and out under the water, but to actually do it for 20 seconds. And some folks say sing the happy birthday song 3 times. I'm a Star Trek fan, so I like to go space, the final frontier. These are the voyages of the Starship Enterprise as I'm washing my hands very, very well. And that is another wonderful way to prevent infection. So if folks are on public transportation without masks, I would try to find an alternative means of transportation. But these are ways you can protect yourself with public transportation. If you are flying, you know, the airlines have cut back their flights quite a bit. And the air is not as bad as folks think. They have HEPA filters and other filtering mechanisms and get air from the outside so that the recirculation is not as damaging. But wisely, they're requiring everybody to wear their face coverings. They did say for a while they were going to kind of keep the middle seats empty, but they're packing the flights now. So, you know, that is a concern, and especially if they offer you food and drinks where you kind of have to slip your mask off. If you can avoid flying at least a few more weeks and see if things change, and instead drive in your own vehicle or in a car with people from one household or cohort that have already kind of been exposed to each other and quarantined or been by themselves together. And that's probably a safer way to get around. I think that's the best answer I can give you there.
No, thank you. As I grab my little hand sanitizer, I
Yes.
carry this everywhere with me. I put it in my bag. And that actually brings me to a next question because I know sometimes people, if they are using public transportation or let's say they went to the grocery store, they just want to like use hand sanitizer really quickly and then wash their hands. So that's actually another myth versus fact. Is there any repercussions or any downside to using too much hand sanitizer?
Um, the amount that we would be using, no. At this point, we feel that it's quite safe. I will say that hand washing with soap and water is the best way to clean your hands, but hand sanitizer is an excellent substitute, especially after you touch something. And you can also use it to disinfect objects that might have been contaminated with droplets or aerosols. So that's a wonderful thing. One thing that can develop with hand sanitizer, and there are some hand sanitizers that have some skin emollients in them, but I would encourage folks, if you're using hand sanitizer a lot, if you start seeing that your hands are getting dry, then have a clean bottle of some type of moisturizer. After you've washed your hands and they've dried, make sure that you can use a moisturizer there. I think that will help keep your skin not itchy or irritated from the sanitizer.
All right, thank you for that. So I have a couple more, and they're regarding food. So who doesn't like to talk about food? So myth versus fact: can COVID-19 be spread through food?
Um, Depends on where you read, but the general answer is not really.
Okay.
I'm not going to say 100% no, but restaurants have very strict guidelines about food preparation. So if they're serving you curbside, or if they're serving you at a table where you're seated 6 feet apart from others, the restaurant has public health officials and occupational safety officials that inspect the restaurants and make sure that they're following appropriate preventive suggestions. In other words, wearing gloves, wearing face coverings or masks, wearing eye protection, hand washing diligently, frequently, decontaminating surfaces. So I'm not going to say there's no risk if you're purchasing prepared food. The risk has been relatively low. We haven't seen a lot of cases that we're aware of that have come from those sources. However, if one thing that I would say is, and again, there are folks that I know who work in this area that like to disinfect things that might have been touched by others. The New England Journal of Medicine has done a study looking at how long the virus lives on surfaces.
Mhm.
And although more recent discussions from the CDC have said that the virus may not be as infectious after a few hours on surfaces as it is when it's fresh on surfaces, they still have guidelines such as 24 hours on paper and 72 hours on plastic. Things like that. So the New England Journal article is a guidance, for example, that I and others who work in this field do. When we go to the grocery store, we'll wear our face coverings. We'll go ahead and I will wear gloves when I'm purchasing my food that I'm going to be using to cook at home. And then when I get home, I take a wipe and I wipe down the outside of the packages, and then I let them sit, if they can sit, without spoiling. Obviously, something that needs refrigeration or freezer, you can't do that. But I let them sit for 3 days, and then I'll use them after that. If something needs to be refrigerated, I just run it with a cleaning wipe. We have to be careful to use something that isn't going to contaminate the food, and that there's a second level of packaging inside. And then you can rinse it off and put it in your freezer. So if you're super cautious, you can do that. But the truth is that that's not necessarily advised by the CDC or by other agencies. If you have someone at home who is in a high risk group, then I would be more likely to recommend taking these extra precautions. And I know many healthcare professionals, including I have done the same thing. I'm at home with, and we are honored to have my beloved 99-year-old father living with us. But when I come home, I go above and beyond just to be sure, because he's in that super high risk age group. So I do that very diligent hand washing, and I change my clothes, and sometimes I'll take a shower if I think that that's the
Yeah, that's
not a
exactly.
good idea if you want to be super careful.
No, yes, that's exactly what my mom does. Because again, as I mentioned before, my mom is a nurse, and when she comes home, she changes out of her clothes so quickly, jumps in the shower, and she doesn't even work in the quarantine unit. My mom, but she's still so she wants to take precautions. So I understand the importance of that because you never know.
That's why a couple of things that we're learning about the virus, and I think in a few months down the road, we'll have much more information than we do now. We're learning daily, but things are changing daily. But they have done some studies in hospitals and healthcare facilities that because of those droplets and aerosols, a floor tends to get virus particles quite a bit. So that's an area of contamination for health professionals that they have reported through the research. One other thing I wanted to talk about, and I'm just going to move away before I forget from this particular question, is that you were asking about the fall earlier. And we are hoping that this virus does not return to create more infections or a second or third wave, either early fall or late fall. We do expect flu season in California tends to start a bit later than in other parts of the country, but sometime around November, December into sometimes early spring is when we have flu season. And obviously, flu shots are a great way to try to prevent or reduce the severity of flu. So we have them at the health center, and they're also free at grocery stores and pharmacies. So we encourage folks to get their flu shot every year. But scientists are a little bit, they're kind of keeping their eye out, making sure that we don't have to take a step back if COVID decides to rear its head again more actively in early or late fall. So we will keep students updated. If that happens, and I hope it doesn't, but if that happens, we might have to go back to a lockdown or quarantine kind of setting for a few weeks until things smooth out. But let's hope that things will stay quiet for the fall. Yes, I agree.
No, yeah. So, what I am hearing is that students will have access to the cloud center not only summer but for fall, whether it be telehealth services.
We will stay open.
Okay.
We will stay open even if we have a new wave of COVID, but we're all hoping that it doesn't happen.
Thank you. Thank you for sharing that. I think the last myth versus fact that I had on here that I got surprisingly a handful of students were very concerned about this, is that if should a student be concerned or refrain from using water fill stations either in a shared space or on campus? I know that CSUN is very big in sustainability, so I wanted to ask this question because a lot of us do bring our own water bottles to refill them, but should we?
It's a good thing. I'm actually so sad because we've all been working so hard on sustainability. And now when we go to the grocery store, those old plastic bags are back and we can't use our paper bags that
I
we've been
know.
finally have learned to use them and use them diligently. And now we're back to plastic. So we do want to focus on safe sustainability. What I would say is we're not eager to have folks use water fountains because water fountains, when you're leaning forward, it's very easy not only to drop secretions, but to touch the mechanism there with your lip, and that could spread. So I would not have folks use water fountains. But if you have a faucet and you can avoid any contact, some of these water fill stations have either one of those little levers,
Sensor, right?
yeah, or a sensor, and you can just stick it in. Now, what I would do if you use something like that is I would wipe down your water bottle on the outside with the disinfectant before putting it in a water station, because you don't want to have where you had your mouth on it a contaminating that station. If you have a cap on that water bottle, take the cap off and keep it with you, and that will, and wipe down the other part of it on the outside. I don't want you drinking disinfectant, of course, so don't put it on the inside. And then put it in so that it can fill, and then pull it out. And then after that, you should wipe the outside again. But I would not use a water fountain. I would not use a commonly used faucet that has been touched by many other people. And if you're not certain about the cleanliness of a particular fill station, then I would go ahead and try to find some other place on campus. Some places have kitchenettes that they disinfect, that you can go and get water, or you might be able to do it at one of the food service areas where you can buy a bottle of water and then fill your um, uh, drinking vehicle, or the container yourself. One thing about containers, it's critical not to share them with others, either food or eating utensils or drink containers. So much better to buy someone, and I know they're usually plastic, so we're taking a step back, but it's much better to buy a fresh bottle for a friend who wants to drink something rather than sharing your water. Because even when you drink, even if you're swallowing in, it's going to wash out your mouth, and some of it's going to come back and contaminate the water for others.
No, so thank you so much for sharing that, for sharing so many resources. Have you heard anything or any other concerns that we haven't talked about yet from students?
A couple of things I just want to let students know. First, if you are interested in getting information from the SHC, give us a call first. We like to have folks call in first, and then we have registered nurses who serve in triage, and they can help you decide whether this is something that we need to see you at the health center for, or whether we can assist you via a telehealth message, or phone, or some other way that's more helpful for you. So we do ask folks, we prefer if folks ask by appointment, and just call us at 818-677-3666, option 1, and we'll pick up quickly, and we can talk to you and set you up with the nurse and the doctor, depending on what your health and education, physical health, and mental health needs are.
Perfect, thank you. And then, did we get a chance to talk about the curbside pickup? I don't remember.
No, we didn't actually. We have a pharmacy, and we have a ability, if students don't want to come into the health center, we can arrange with our pharmacy. And the way to do this is on our website.
Okay.
And basically what you do is you communicate with the pharmacist by phone and email, and then they educate you over the phone when you arrive in our back parking lot, and they'll bring out your medications to you with gloves and a mask, so that you don't have to worry about being in an environment where we sometimes do have folks that are ill. And this is a way that you can get refills. And we're doing a lot of medication refills and family planning refills, things like that, through telehealth. You don't necessarily need to come in for an exam anymore for many of these types of medications and prescriptions. One other thing I wanted to talk about that we're going to be reopening in the fall is we have optometry services. So we're going to be looking at reopening those with the appropriate personal protective equipment and disinfection to keep you safe in the fall, and dentistry will be available. So that we're going to be holding off on cosmetic procedures, but if you have a cavity, if you need a crown, if you have tooth pain, any of that, our dentist will be available, and they'll be working with our UCLA dental school faculty to be able to make sure that we keep you safe while we're doing dental procedures that you need. We don't want you to sit in pain for an extended period of time. Our sports medicine department will be also seeing more students during the summer and in the fall to provide any needed treatment to help with rehabilitation of injuries and helping folks get back onto their athletic activities and physical activities.
Oh, okay. Oh, that's exciting, and it's so nice to hear some UC and CSU unity going on. I think that's really exciting.
Mhm.
Well, I want to thank you so much for your time again. It's so amazing to get a chance to talk to an on-campus administrator and especially the director of the Cloud Center. So thank you so much, Dr. C. I really appreciate your time. I know that the student body will appreciate your time. Is there any last minute thoughts that you want to leave us with?
Well, I'd like to say, first of all, that we are here for you. The Clot Center is your student health center, and please don't hesitate to call us. We're available Monday through Friday. I also want you to feel free to reach out to me. My email address is available. It's lchassiakos@csun.edu, but I know my last name is hard to spell, so you can find it on, at our website. And please feel free to email me or Sharon Aronoff with any questions, or SHC info. Those questions will get answered quickly by people who have the information that you're seeking. shcinfo@csun.edu. I want to try to leave with a message of encouragement and of hope. We will get through this, and we will get through this together. It may take a little longer than any of us would like, but we're going to be here for you during the tough times, during the times that you need someone to reach out to. Please think about reaching out to us. We are here for you. Clot Center and University Counseling Services. We want you to have hope. We want you to be, they used to call it social distancing, and now I'm glad they've changed it to physical distancing, because we don't want you to be socially distanced. We want you to connect with others socially through any way that you can safely do so. Zoom is a wonderful way, phones, technology, and where it's safe through the masks and the 6-foot separation as guided by our county public health officials. Humans are very social, and we need that to stay healthy and mentally healthy. And we want to be able to support you as safely as we can, to reach out to others and to feel like you're not alone during these difficult times. And especially when we're also struggling with some of the tragedies, as I mentioned earlier, that we've had this week. Again, feel free to reach out to us and our resources, whether it's in the health promotion department at CLOTS or University Counseling Services, to talk about your worries, anxieties, feelings, concerns, anger, frustration, anything that you'd like to talk about. We're here for you, and we care. We're here for you. We care for you, and we want you to know that anytime that you reach out to us, we will do our best that we can to help you.
Oh, thank you so much for that encouraging message. I think that it says a lot as we come together as matadors during these trying times, because it's not easy right now. It's not easy for students, for staff, for faculty. So thank you so much again for those encouraging words. And I know it makes me feel like, wow, CSUN does care. And I love that. And I love having this conversation with you, and educating myself even more on this pandemic and how to handle this pandemic with what's everything that's going on these recent past few days. So thank you so much again. It's so appreciative. Thank you.
It's our pleasure. And if I can put in a little plug for the Student Health Advisory Committee, which is student-led and student-run, and it's the advisory board for your health center, for the CLOTS Health Center, by students, and they also advise the president and senior leaders. So we'll start having our meetings again in September. If you're interested, please contact me or SHC Info, and I'll connect you with the SHAC president. And we meet 1 hour a month. But it's an opportunity really to provide your input to the health center, and then to learn more about the health center and spread the word about the resources we have for our entire student community. So please, if you're interested, please come and join SHAC.
No, yeah, I think that's a great opportunity for students. If you're not involved on campus now and would like to be involved, especially if you're heading towards a healthcare career, please, your voice matters. I cannot stress that enough. Your voice matters. And this sounds like such a great opportunity to get involved with other campus partners. So definitely, I will be part of that committee, hopefully, for this upcoming year. So I'm excited to see the kind of conversations we get to have in those committees. So thank you once again. I
Our
appreciate
pleasure.
you on.
Thank you. And we hope, I just wish health and safety for everyone and a gentle summer and fall.
Yes, of course. Thank you everyone for watching, and stay strong, Matadors.